Welcome Yamhill County to Speaking Frankly. I'm your host, Howie Harkema, and our tagline is, "And how we doin'?" I have two guests with me today. They're both from Willamette Valley Hospice. And first of all, we have Darlene Corral, who is a licensed clinical social worker and medical social worker. Welcome, Darlene.
Thank you.
And we have Horacio Gomez, licensed massage therapist and Yamhill County outreach coordinator. Horacio,
good to see you.
Nice to have you on Speaking Frankly.
Thank you.
Thank you.
So our topic, as you heard, is about Willamette Valley Hospice. So what is Willamette Valley Hospice?
Willamette Valley Hospice is a nonprofit hospice organization that's based out of West Salem. We serve various patients out in Yamhill County, Marion County, Polk County, and Benton County as well.
Very good.
It is also a community-based hospice. The board of directors, support us a lot. And if any of the employees have any ideas to share, supervisors and the executive director are more than open to technically you listen to us, and they develop new programs based on that.
That's awesome. And you guys are one of the only nonprofit hospices in the area.
That's correct.
That's really awesome. A lot of people don't know that. So could you give us a short background history on Willamette Valley Hospice?
You can go ahead.
Willamette Valley Hospice was founded in 1978 by Helen Murray. She was a director of community health for Marion County, and she invited members in the community to come together and talk about, what were the issues that were affecting the community that were facing terminal illnesses.
Sure.
And they wanted to try and find a way to help them, and that's how the Hospice Interest Group was founded and started Willamette Valley Hospice.
And it was a very large contingent of people.
It was.
Yeah, there were originally 33 people that were involved in this project.
Fantastic.
And eventually, the years went by. Hospice, of course, they started getting busier and busier.
Sure.
The funding came from the United Way, most of it, as well as foundations. Foundations and private donations.
Sure.
As hospice developed more and more. The name in the society, it came to a point where they had to apply for a Medicare as well. So there was also a $30,000 donation to do that kind of the fee that was made, and also a $10,000 donation that was anonymous to make that happen.
Wow, that's incredible. So you guys being a nonprofit, you have to have a mission and vision statement. So what is the mission statement?
I'm going to read those.
No, please, yes, we all have notes.
The mission statement is changing the end-of-life experience. The vision statement is a world where everyone facing serious illness, death, and grief has access to the best personalized care.
That's great. That's a great cause and a great mission and vision. So how many people are on the board of directors?
At this point, it's only 14. It was 15, and actually there is one opening, and we're actually looking actively to do that. We have no members on the board from Yamhill County yet, specifically from McMinnville or Newburgh. So if anybody is interested, it would be nice if they can contact directly to the office, and they will let us know what are the qualifications to be part of the board.
Sure. So Paul, could you bring up the website, please? Because they might be able to do it over the website as well. That would be great. So do you need volunteers in Yamhill County?
Yes, we do. We could use anywhere between 3 and 4 volunteers, and there's lots of opportunities. They can volunteer working directly with patients. They can volunteer doing our Pet Peace of Mind program, which is a program that helps the hospice patients that have animals. It helps cover their visits, take them to vet care. So a volunteer could come in and help transport the animal to those appointments, or help walk the animal. Maybe the patient's not able to do that anymore. There's also opportunities within the office, so if you're not someone that wants to go out and be with patients, you could help in the office making copies and building our patient handbook. So there's lots of opportunities available. We provide the trainings, so It's very intensive. It's an entire day training, and they do background checks. We're very thorough on
Sure.
that
Who does
process,
what.
who
Yep.
does what. So, and then the mileage is also reimbursed. So,
Oh, that's
if,
neat.
and
Nice
if you're
stipend,
traveling,
yeah.
if you're traveling, your mileage does get reimbursed.
What about respite care? Do you need volunteers to do that type of thing as well?
Yeah, there's opportunities to give family members respite. So you'd go into the family home,
Right.
and you would spend time with the patient while the family member maybe goes to run errands, or maybe they just need a rest. We also have what we call vigil volunteers. So if someone's interested in sitting with a patient that may be actively dying,
Right.
and maybe for that person it was important not to die alone, or for the family members who maybe live out of state and can't be there, we constantly use the vigil volunteers for that purpose.
So it's so awesome to hear you talk about all of this, because at end of life situations, sometimes families are thousands of miles away.
Yeah.
That's
Yeah.
so awesome.
Yeah.
So you have other trainings besides those trainings as well. Do you have anything coming up?
The next volunteer training is happening November 18th, and it's from 8 to 5:30. So it is the entire day, but the training is very intensive. We do a panel of the entire hospice team so that they learn about what we do as
Sure.
well. There's training on the equipment that is commonly used in the homes when someone's on hospice, and there's lots of other education about, our organization, our background. So it's a very intensive and good training.
And where's the location for this?
It's at our office in West Salem.
Okay, very
Yeah.
good.
And if I can add a little bit
Yes,
to that
please.
one as well, the volunteers can be as young as 12 to be working in the office. And if for whatever reason people from this area would like to be volunteers, but they don't have transportation, somebody from the office will come to their
Oh,
home
really?
to conduct the interview. There's also a background check that needs to be done, and
Right.
once they are actually approved, they need to get a TB test, which is only a little poke in the arm,
Yeah.
so it's not going to hurt anybody. But those are another thing that the volunteers need to do.
And then after the TB test, 2 days later, someone has to look to make sure that it was negative,
In
right?
48 hours,
Yeah.
48 to
Yeah.
72 hours.
That's what I thought. So we do that at McMinnville Free Clinic as well. All of our volunteers have to have a TB test and
Yeah.
blah, blah, blah. So you guys have some great TV commercials that I've been seeing for a number of years. And not everyone knows that you're a nonprofit from these TV commercials, but we have a little clip, a 30-second piece of one of your commercials. Paul, could you run that, please?
As the only daughter, you want to make sure you're doing things right.
An advance directive really that's one of the greatest gifts you can give to your family members or your children.
Having witnessed families being able to stay in their home and receive quality care and be comfortable, that's how I want to go.
The Willamette Valley Hospice staff was so knowledgeable.
They know their work. They're angels.
Yeah.
So those are fantastic. I've seen a number of them over the years, and they're so effective. You guys must be so proud of the way that it's handled.
Yeah, we really are. The whole goal of that project was a collaboration between Willamette Valley Hospice employees and past family members that we had served, and the goal of that was to really bring out that education of who we are and really inform families that when you are choosing hospice, when you know who you want, so that you can call us by name and let your doctors know Willamette Valley Hospice is the hospice that I would like for my
Right.
loved one.
And not everybody knows that they can make that choice.
No, not everybody does. There are a lot of other hospice organizations, and we all do similar work, but we each have our differences that set us apart.
Sure. So who does those commercials for you?
It was a collaboration between Transcend Marketing and Allied Video, and they are based out of Salem.
They're fantastic. It's great. So, would you like to talk about your programs?
Yes, please.
So, Advanced Illness Care Coordination, or AICC.
That is a new program that we just started. It's a collaboration with Yamhill Community Care, which is the OHP provider out here in Yamhill County.
Right.
What they found was that they were seeing not many of their clients were utilizing hospice services that maybe could have benefited from the services. So we created this program to help identify who those members are that have an advanced illness and maybe need some education in the home about what is their disease, what are the doctors telling you, what do you understand, what are your goals of care, and how can we more effectively manage that in the home, and to begin educating about what is hospice.
Sure.
What are my options if maybe they're pursuing treatment and treatment is no longer effective, then we want them to know what is the alternative, what's on the other side, as well as letting them know about community resources that are available to help meet their needs now and in the future.
Right. So when you say they, you mean not only the patient, but the families
family
of
as
the patient,
well.
the friends of.
Yeah.
Very good.
Yeah.
So how does the referral process for hospice care work?
The referral process for hospice works, that can come, there has to be a referral that comes from a doctor. So that could be the patient's primary care doctor, or maybe they end up in the hospital. And the doctors there say, you know what, have you considered hospice? And then that's where the referrals are initiated. It doesn't always, that first conversation about hospice doesn't always have to be initiated by the doctor. It can come from the family themselves. Maybe they're seeing that their loved one isn't doing well. Maybe they're losing a lot of weight. They're getting frequent infections. They're having to go into the emergency room or the clinic a lot. Or maybe they already have been diagnosed with a terminal illness and they've decided, we've tried treatment options and they're not working. So we want to focus on keeping our loved one comfortable. Then at that point, I would recommend maybe having that conversation with your doctor, or even calling us directly, and we can help facilitate that communication and get that referral for them.
Get that discussion going.
Get that discussion going as well.
So it's the patient's choice
Yes.
which hospice branch they want to utilize.
Exactly. Yes.
And they can also switch it
Yes.
if they know that somebody else might work better with them.
Yeah. Yeah, and we always, we sometimes, we're all, even though we're all different, we all still want that person to have the best experience, because you only get to do that once.
That's correct.
And we want to make sure that you have what's going to be the right fit for you and your family. So sometimes family members may sign up for a certain hospice provider, and as they're working with them, they may feel that it's not the right fit for them. Then they have that option to switch providers, and we will help with that facilitation. And then sometimes too, when they first go in the hospital, that's why we say, let your doctors know by name. If you already know in mind that you want a certain hospice, that you tell them by name which one you want.
Do you have anything to add to that?
No, really for that one.
Okay. Let's talk about legal assistance and referrals to legal assistance.
Okay.
That's all
That's me?
social
Okay.
work, yes. I'm not gonna go
So
there.
our
all
social workers are available to help family members with having those discussions about end-of-life planning, caregiving. Sometimes we promise our loved ones that we're going to care for them till the end in the home, but sometimes it's not possible.
Right. Independent living isn't always possible.
Living, exactly. So we have those hard conversations of, there are other options in the community. There's in-home care, there's assisted living, nursing home. So we help refer the family members to organizations that will help with that, like senior services or veteran services if they're veterans, to see how they can help pay for those things. We also refer to, give them names of elder law attorneys if they're looking for power of attorneys. We can work with them on advance directives, and we do provide those to the family members and patients and encourage them to complete them. So we try and refer them to whatever organization we know that can help them with whatever legal issues they are encountering.
That's incredible because that's a real benefit.
Yeah.
They're already in a place where they're so vulnerable.
Exactly.
It just makes so much sense to handle this
Yeah.
right then.
Yeah.
So let's talk about therapies. Since you are a massage therapist,
Yes.
Horacio, let's talk about therapies. Let's talk about music first, how that works into the interaction of this.
Usually what happens, the nurse makes an initial visit to the patient, and based on the needs of the patient, music, massage is usually referred to us.
Sure.
And technically what it is in this case is for therapeutic purposes. Music is calming and actually reduces pain.
Sure.
And that's also where the massage part comes through. Usually I don't go in with the idea that I'm going to really work on somebody really hard because they are frail.
Right.
There is always a patient who's going to try to do it anyway, and then 2 days later they don't like me that much. but the point is just to start with being in the referral, and we try to see him once a week, maybe every other week or once a month, depending on what they want and what they need. We develop the care plan individually to see what the need of the patient is, and then we just act accordingly.
Yeah. And for music therapy, we've used it for many, many different situations. If there's a patient that's restless or very agitated, we will refer in music therapy to come in, because we don't want to just use medications to treat someone. We want to find other ways that are alternatives that help bring comfort to family members. Music therapists will commonly work with families who are grieving and to find a way to process that grief. They are trained in counseling and music. So they have worked with families in writing their own songs. They bring instruments to help the patients have that tactile stimulation and play. Or if they just want to be quiet and just listen to music, then they'll just sing, or whatever the patient wants, they will adjust to whatever the patient needs.
We live in a vibrational universe, and we're all vibratory human beings. So music is probably one of the key elements that can bring that anxiety and frustration and stress level down.
Yeah.
So,
And sometimes with patients that have dementia and Alzheimer's, they may not communicate at all, but bring in the music therapist, and they're singing. And family members, and they're smiling, and family members just get so amazed to see, this person that's still in them. And music is the way to help them communicate and express themselves.
And that is also one of the things that Willamette Valley Hospice is different than some other hospices. We're the only hospice with music therapists who are actually certified.
Yes.
Hospice certified, and once in a while we are able, or I have been able and honored to work with them in a music session and a massage at the same time, and it just, to me,
how perfect is that?
Yes.
Doing an adjustment while listening to music.
Yeah.
Yes.
Or they'll even go in with the hospice aides, maybe a bath, maybe it's traumatic for the patient, or they're just wanting to relieve pain issues because the CNA is coming in and giving them personal care.
Sure.
So we do a lot of collaboration together to achieve whatever goal it is that we're trying to achieve.
That's fantastic.
Yeah.
So would you talk about pet therapy?
The pet therapy, so we have a group of volunteers that have pets that are certified to be pet therapy pets. So we make referrals, we make the volunteer referral, and if there's anyone that wants to have the pet therapist come and visit them, then that volunteer is assigned. She or he will come in and bring the animal to the patient. The one I can remember the most was we had a patient he had dementia, and he really didn't communicate with anyone, but you brought in an animal and he just lit up and talked to that animal and would pet it, and he was just so happy. So, just those simple things, little things that we don't think about, it just brings so much joy to them. And our whole goal is always to, how can we improve a person's quality of life? What can we do to make these final days, however long they may be, make them the best they can be?
So you also have occupational therapy?
Yeah, so All of the hospice benefits have options for occupational therapy, speech therapy, and physical therapy.
Sure.
So those normally are used as consultations. So if we're trying to achieve a symptom management issue, maybe do some teaching with the caregivers on how to transfer someone safely. Maybe someone's having some swallowing issues and we need a consultation on what can we do, what kind of textures do they need.
Right.
Then we will do consultations with those services. They're not meant for restorative purposes like they normally would be.
No, because you're at the end of life.
Yeah, but we do have that option to help bring some education and comfort.
That's fantastic. So, would you talk about the Edward F. Tokarski home?
That is a home that we have next to the office. It's located also in West Salem. The house is 5 years old. It's a home where there was a dream to have a foster home for those who don't have a place to live.
Sure.
Towards the end of life. And thanks to major donations, the house was made possible. There is 5 private rooms. Every room has plenty of space for family to actually stay there with the patient if they need to stay there overnight. There is an area where they can just kind of retreat and be the family by themselves if they need to be. There is 24/7 care. The majority of the people who are actually there, about 30% of them are veterans who have no access to anything. Even though they may have VA benefits, they never look for them, and sometimes they need a place to stay. So they actually stay in the Tokarski home where they are actually being taken care of. And not only there, we have as volunteers other veterans that come over and do a service for them as well, during the stay.
Yeah, and we also serve, we really believe that we want people to have access to care regardless of ability to pay.
Right.
So we do serve people there no matter what. We have a philanthropic care application that they fill out, and we do whatever's necessary to make sure that that person has access to that care and placement if it's necessary.
And that is so important.
Yeah.
Would you like to talk about Walk and Wag?
The Walk and Wag is a fundraiser event that was started 4 years ago, and it was developed to help fundraise a new program that we started, the Pet Peace of Mind program, that helps fund vet care bill. It helps pay for vet care,
Sure.
animal food, and also to help find placement for the animals of
that's
the patients.
fantastic.
Because sometimes they don't know, they don't have a plan, they don't know where they can leave their animals. So we want to give that person that reassurance that if they pass away, their animal is going to have somewhere to go. Because
home.
sometimes that's their family.
Right.
So that event this year, there was over 300 people who attended.
Wow.
And it's held at the Minto Brown Park in Salem. It's a $10 entrance fee, and we accept donations. There's lots of events, music. We had 30 vendors there offering, pictures of the animals. Veterinary services, low-cost immunizations were there, and it raised over $21,000.
That's
and that's
fantastic.
all 100% to help fund this Pet Peace of Mind program. And with that program, the Willamette Humane Society, they have collaborated, and they actually created what's called the Hospice Angels program, where they accept the cats and they promise not to euthanize them and try and find them
That's
homes.
fantastic.
Yeah.
Because that's a major problem.
Yeah, it really is.
So cool. So you guys have some upcoming events. Would you like to talk about Knowledge is Empowerment, a symposium for end of life?
I'm going to read the information because
Yeah.
it's a lot. It's going to be held on Saturday, October the 22nd from 8 a.m. to 2:30 p.m. at Dignity Memorial, 1350 Commercial Street. It's going to cost $12, and they're going to be talking about death with dignity, advanced directives, financial planning, memorial, funeral planning. What is hospice and palliative care? There is going to be a Dr. Hansen from Kaiser Permanente, and there's going to be somebody else. I don't remember who the other person is.
There's another physician that will be speaking, and the $12 does cover lunch. So.
And that's catered by a group out of Silverton. So music therapy is also included in this. At this venue, you have CDs offered on your website for people that do that.
Yeah, if they'd like to purchase, they can purchase it.
Right.
I believe it's online. It should tell you how you can
Yeah,
purchase
exactly.
it.
So,
Yeah.
Paul, would you bring up the Facebook page as well? Thank you. So, grieving a loss. That's families end up really grieving at the
Yeah.
end of this
Yeah.
loss.
And one of the things that, we believe that we are the experts of care in walking the end of life journey with these family members and helping build their confidence to know what to expect. But we don't just leave them once the patient passes.
Thank goodness.
We continue to walk that journey with them, except now it's the grieving journey. And we have 4 bereavement counselors that are available. They are available to do individual sessions with these family members. We have support groups that we have in the office that are held. We also have workshops that they hold. One that's going to be coming up is the Coping with Grief at the Holidays, and that one's going to be on November 12th, Saturday, from 9 to noon, and it's for adults and children age 5 and over. So those events. They also hold every summer Camp Mighty Oaks. It's a camp for children and families to have an opportunity to come and express their grief, talk about a loved one that they maybe have lost, and lots of activities, fun activities for them to do.
So you don't leave everybody after the passing of the
No.
loved one.
No.
You give them an opportunity with counseling
Yeah.
to move forward.
Yeah, and even if they don't want any of that, we still do the telephone support, so we call at different intervals. We call usually within 2 weeks after someone passes to check on them, within 3 months, 6 months, 1 year, and there's lots of different intervals that the bereavement
Sure.
counselors are checking in on them.
And I'm sure it's
Yeah.
different for each individual
Yes,
and the family.
Yeah.
So,
Sometimes the support groups as well, you don't have to be a family member of somebody who actually passed away. If you actually have just somebody who passed away, not in hospice,
Yeah.
you're more than welcome to come.
Yeah.
They have a walk-in group. They have sessions in the evenings as well. And for those who are not able to speak English, they try to get an interpreter.
Yeah.
Usually it's mostly Spanish, what we're having so far.
and they have a unique group too, for people who have suffered a loss to suicide.
okay.
It's a suicide loss group. So they found, because they do the community bereavement support as well, they saw that there was a need to have a specific group to address that specific kind of
Sure, and I
loss.
can
Because it's
understand that.
different. It's very different.
Yeah. So we have about 2.5 minutes left. Let's talk about December Memorial Coping with the Holidays workshop really quick, and then we'll move into the last 2 questions.
Yeah, the December Memorial, it's called the Light Up a Life Memorial Gathering. It occurs on Thursday, December 1st, from 4:30 to 5:30, and then they do it again from 6:30 to 7:30. So if someone can't attend at that specific
Right.
time, usually the music therapy therapist is there. They play music. They'll probably do some readings, an opportunity for maybe people to say a few words of someone that they have lost. And it's just a time for us to come together as a community and support one another.
It's got to be hard during the holidays.
Oh, yes. The holidays are
Especially
very, very
that first
tough.
year.
Especially the first year. We always tell family members, the first year is always the toughest because you're going through the first holidays without them, the first birthdays without them, the first anniversaries without
Right.
them. So they created that coping with grief in the holidays to really help support family members and people in the community that may have suffered a loss.
That's a true blessing to the
Yeah.
community. Thank you for doing that. So really quickly, what was your background prior to coming to hospice?
So prior to hospice, I kind of did my straight from high school, go through school. So I went for Whittier College. When I was in Whittier College, I did a lot of group with children and families. And then when I came up to Oregon, to Portland State University, that's where I decided, okay, I want to try something different because I worked as a caregiver. And that really sparked my interest in hospice care. Working with a caregiver, as a caregiver, we had a patient that a hospice social worker came into the building, and I had no idea that social work was in that arena.
Sure.
So that's how I kind of started working in hospice care.
And Horacio, how did you come about this?
Well, I always been curious regarding anything medical. Back in Mexico, when I was born and I moved out of there when I was 25, I used to be a podiatrist assistant. So I moved to the United States, and between the learning English and everything else,
Sure.
I started working as a caregiver, and then I moved up to massage therapy, and eventually gave me the opportunity to work with public health. And then I saw the opening for the massage therapist for Willamette Valley Hospice, and that's where I went to apply right away.
So really shortly, why have you guys become involved in this important community work? And we'll start with you, Horacio.
In my case, I think it was a detachment from my family. I don't have a family. I'm alone in this country. Besides my wife and my kids, there is really nobody else in this country that I can be attached to.
Sure.
And so the willingness to serve and help others, especially in their last days, it's just an honor to be with them.
Awesome. And Darlene?
I think for me it was, the loss of, I lost my grandmother suddenly, and we never got to do hospice or anything like that. But I think having that opportunity to support someone when they're going through such a difficult time,
Yeah.
to give them some comfort and some reassurance and help support them as much as I can, and giving them resources during a time that they're so scared of what's going to happen. I think for me that's what has really drawn me.
Very good. So, Darlene, thank you.
Thank you.
Horacio?
Thank you very much.
Thank you. So folks, if you're at the point where you need to get some family member and or yourself involved in the hospice care scenario, look strongly at Willamette Valley Hospice, because they are a nonprofit and there's no charges or limited charges for all of this through them. So thank you for watching.